Yeah, it was a pretty bad accident, and the injury that I sustained that was most noticeable at that time was that my hip was broken in 3 different areas. It got crushed between the door and the steel area that holds the radio and all that, the lighting for the police car. So we went to the hospital, and I was there for about 7 days. And it was my hip that all the attention was given to. And I do remember having migraines, excuse me, what I thought was just a really bad headache, but it was there was a lot of light sensitivity. That was probably, I had maybe a handful of those. But pretty much it was just, I think it was just kind of ignored at that time.
One of the things that I don't think people understand or realize, and rightfully so, because when there's a victim of traumatic brain injury, a survivor, excuse me, everybody's concerned with how are you doing? Or how is Jenny doing? What's going on with her? Very few times did somebody ask, Ed, how are you doing? How's Marcus doing? And I don't say that because I begrudge them for that whatsoever, but I think oftentimes that gets left behind. People don't think about that or consider that. So I was really grateful when Rehab Without Walls came into the picture. They were the first that actually had a social worker. It was designed to care for Marcus and my needs as far as helping us cope with this. The first thing that she did when she came into the house was she gave me homework. She had me go on the internet and look up what is TBI and what is the symptomology. Because up until that point, I had never heard of it. Never heard of it. So I went on and I learned, and I'm like, oh my God, this is one of the things that this is another thing that I'm seeing. All these things, it just started validating what I had been saying all along. So I thought that was really, really beneficial as far as helping us deal with that. Because as a family member or a loved one that's helping the survivor, we don't really get a break. You can't run away from it. You've got to deal with it.
Post-concussive syndrome can be confusing too, because a lot of people expect these symptoms to come on the day after the injury. They don't. They come on very delayed. They can come on 3, 6, 9 months after the incident. Okay, so it doesn't have to be that, well, there's no way that this could be a real brain injury because it's 6 months after the injury. They're just now complaining of irritability, frustration, personality changes, sleepless nights. No, it can come on. Or it can be masked by other things. Like we heard Jenny talk about how, well, maybe I'm just irritable because of pain. Or her husband Ed talk about how, yeah, she was different, but I had a lot of reasons why she should be different. Right? And that's very common because a lot of times these people are banged up. They're banged up with orthopedic issues.
As soon as you can get them in an upright position, it's important that you do it every day, that they're up. They're up in a chair, they're up in a standing frame. You can see here the guy on the right. I love this picture. This is from one of our facilities in Marin. But he's up. This guy is barely awake. He's like a 2, maybe a 3 on the Rancho scale. But he's upright, he's standing, he's positioned, and he's outside. I mean, how nice is that? And, you know, he's going to be so much more alert than maybe he would be if he was in bed.
Okay, I'm going to talk about a few things because you're all sitting here wondering and say, well, now, how do I do better as I age? And you know, this isn't all data-based, but it's pretty good consensus, I should say, in terms of some of the recommendations about how do we all try to age-proof our brain, whether or not you've had a brain injury or not. You know, some of the things are physical exercise. Get moving. You know, we talked about the cortisol issue, about, you know, stress levels. Cortisol increases your midline, it increases your stress, it reduces your life. And so exercise can lower your risk for Alzheimer's.